Assalamu alaikum guys, I am Dr. Aftab Ali. I'm going to discuss cerebrospinal fluid circulation. So here are my learning objective too. So first of all, what is CSF? Brief anatomy of ventricles, how CSF is produced, how CSF flow, and how CSF is absorbed from the ventricles, and what are the CSF circulation disorders, and last but not the least, recall questions. First of all, what is CSF? CSF is a clear fluid that surrounds the brain and spinal cord. Act is cushion and protect brain and spinal cord from injuries, and it provide nutrition and remove waste material from the brain. Now the anatomy of ventricle system. Ventricles, there are 4 ventricles, 2 are lateral, and one is third ventricle, and then fourth ventricle. Ventricles are basically CSF filled cavities in the brain. Okay, this is the lateral ventricle. So lateral ventricle have a body, an antrum, and 3 horns: frontal horn, occipital horn, and the temporal horn. So in the lateral ventricular, the red line is choroid plexus, from which the CSF is produced. Next is foramen of Monro, which connect this interventricular foramen, which connects the lateral ventricle to the third ventricle. Then there is a duct known as the aqueduct of Cilius or cerebral aqueduct, which connects the third ventricle to the fourth ventricle. The fourth ventricle is a like triangle or diamond shape. From this fourth ventricle, foramen of Luschka and Megendie communicate with the subarachnoid space. So CSF produced from the choroid plexus of the ventricles, mainly the lateral ventricles. This red line is the choroid plexus. In this is in the lateral ventricle, this is in the third ventricle, and there is a fourth ventricle. The mainly CSF is produced in the lateral ventricle. Then it flow like this green arrow showing the flow direction. It's flown from the lateral ventricle to the third ventricle via foramen of Monro. Then from the third ventricle via cerebral aqueduct into the fourth ventricle. Then from the fourth ventricle, it goes into the subarachnoid space via foramen of Luschka and foramen of Megendie. There are 2 foramen Luschka which are lateral, and there is one foramen Megendie which is central. Now moving forward with the CSF product, CSF absorption. CSF absorbs from the arachnoid villi into the dural venous sinuses, then into the blood circulation. About 80 to 150 ml of CSF is produced and absorbed between 3 to 4 times per day. So total 500 of CSF is produced daily. Disorders of the CSF circulation. Here we can only discuss the hydrocephalus. So what is hydrocephalus? A condition in which CSF accumulates in the drainage system of the brains, enlarging the ventricles, which eventually enlarge the brain and cause pressure on brain. We can classify hydrocephalus by obstruction to the CSF flow, decreased absorption by arachnoid villi, increased production of CSF by choroid plexus. Now come to that picture again. So if the obstruction is at the level of the foramen Monro, so then the dilatation of the lateral ventricle occur. Okay, now if there is a obstruction at the cerebral aqueduct, then the third ventricle dilates. If there is a obstruction at the level of the Luschka and Megendie, then the fourth ventricle will be dilated. So that's how in exams the question will be like, if there is a obstruction at the foramen Luschka and Megendie, what will happen? So you will choose the answer. There will be dilatation of the fourth ventricle. Okay, now come to the second point, decrease absorption of the CSF fluid. When there is an infection like meningitis, encephalitis, or torch infection. So in these infections, so there will be decreased absorption of the CSF. Or there will be hypoplasia of arachnoid villi. If there is arachnoid villi hypoplasia, there will be decreased absorption of CSF as well. Now, increased production of CSF, it's mainly due to the CSF producing tumors like choroid plexus papilloma. Okay, now moving forward to the one example of aqueduct stenosis. So what happened in aqueduct stenosis, there is example given by the tumor. This tumor is compressing the aqueduct here. So it will dilate the third ventricle. Now I will quickly summarize all this in this picture. So in white color, you see the brain. Here it is a brain. Okay. In between the brain, there is a corpus callosum. This is the corpus callosum. So beneath the corpus callosum, there is a lateral ventricle. Lateral ventricle are of, there are two lateral ventricles. One is left and one is right. In lateral ventricle, there is a red line. It is known as a choroid plexus. From this, the CSF produce. Then there is a interventricular foramina of Monro, which is in between the lateral and third ventricle. Then this is a third ventricle. You can see. So this is the red line. It is a choroid plexus of the third ventricle. So now from the third ventricle, there is a duct known as the cerebral aqueduct, also known as the duct of Sylvius. So this duct is drained into the fourth ventricle. Here is the fourth ventricle. So in fourth ventricle, you see the red line. It is a choroid plexus of fourth ventricle. From the fourth ventricle, there are foramina known as a foramen of Luschka and Megendi. So you know all these are communications. There will be obstruction. Like if there is obstruction, foramen of Monro, then lateral ventricle will be dilated. If there is a problem or obstruction at the level of the cerebral aqueduct, then will be dilatation of the third ventricle. If there is a problem with the or obstruction with the Luschka and Megendi, then the fourth ventricle will be dilated. So they ask questions about these foramina or aqueduct. The CSF fluid from the fourth ventricle then into this green line, which is subarachnoid space. So it circulate around the brain whole day, protect the brain. I briefly describe all about the CSF. Now come to the recall questions, which are commonly asked, and as the recalls are recall knowledge of the exam paper, so sometimes it contain poor knowledge and they are incomplete. So don't be confused. Study these topics from books. If you study well, so these are not the problems. So the first one is the drainage site of CSF, means the absorption site of CSF, as we studied, is arachnoid villi. And number two, the dilatation of the fourth ventricle is due to, we know, the fourth ventricle drain into the subarachnoid space via Luschka and Megendi. So if there is an obstruction at the level of the foramen Luschka and Megendi, so fourth ventricle will be dilated. And the number three, which is the main site of CSF production. So we know it's a choroid plexus. Arachnoid villi are the absorption side. So this is just a demo class of our classes. Good luck, guys. So Dr. Fatima, kindly end this video with your valuable comments. Thank you, Dr. Fatima.
Okay, thank you so much, Dr. Aftab. You have explained really well, and I'm sure those who have seen this topic from your video, they are going to, they don't need to open the book and check, because it is all done. It is well explained, and you have actually practically included the recalls and everything. So it was very well explained. Thank you so much. So we'll end our video here.